everyone, we are about to do a splint removal, a nasal splint removal for a patient who's been here for about little over a week. We'll proceed with the splint removal for him. Press this button, sister. Press the control center. Decrease the brightness. Yes, decrease. Okay.
And this having good resistance.
Okay, Deep, I'm just going slow. These are all the stickers. Just a minute, Deep. Okay. Deep, I'll clean up a little bit for you. It's little pinched here. I'll clean that up. Little because it was the splint was placed so tight for so long. You see this redness over here. It will become better Deep. You can have a look at yourself. So even though nasal splint removal was done for him, the surgery he underwent was not a single unit surgery. It was not only nose surgery that he underwent, it was a jaw also. And with respect to jaw, we'll show you the side view. Even this is fine. So Deep, if you can turn to your right, and as you can see yourself in the pre and the post-operative image. So pre-operative image, he had two concerns. A being the chin being short as well as small. By short, I mean the vertical distance, and by small, it's receded in a horizontal direction. So the chin has been worked upon, it's been brought ahead. If you can turn a little bit, Deep, yes. So even you can see in the mirror and appreciate there's been increased advancement in the vertical dimension as well as in the horizontal. So if we see the chin, if we see the mental angle over here, okay, that has been the chin throat angle, what we say, there is a change over here clearly from the pre-operative image. The second change being the angle of the mandible. We did work along with jaw sculpting and angle osteoplasty for him. Right now there's swelling, but once everything subsides, we have defined the angle a bit more. Here the angle was almost negligible or not very appreciable, so as to say. The third change which he wanted was the dorsal hump removal, a nose which is more aesthetic. His nose was never on the bulkier side, so as to say. Though an osteotomy, these are the stitch marks, has helped him get the defined look for the nose. Yes, he does have a little bit swelling here, and all these is because it was pinched for so long. Also the tip, if we see, it's become slim, it's become pointed, it's become sharp. We go on to see the other views, show the other views. Yeah, the front, yeah, even the side view. If Deep, you can turn to your left, the frontal view. Yeah, even we can see this. if we divide your face into thirds, into an equal 1/3, if we see Deep right now, your lower 1/3 is much more balanced than your picture which was taken about 10 days back. The reason being, the vertical height has added some more definition and probably a manly look to the face, which gives proper definition to the lower third as the middle and the upper third. Your nose had a hump which is gone now. It's become linear, it's become more defined. Okay, you do have swelling. The stitches will be removed today. We are hoping the results will only get better with time, Deep. Okay, we will remove this. The right side, look up, Deep, little bit. Yeah, it's already quite narrow for you, Deep. The alar base is already quite narrow. Like, you do not have that kind of a node which is broad and bulbous. Even initially, you never had that.
And this one is all this swelling, right?
Right now, Deep, it looks pinched. It looks pinched exactly where the yes, and plus it was on the skin for so long. So you see how the skin has become. It will become better. That's just a transient thing because of the covering. The protective covering that was there for so long. I'll remove all the sutures for you right now. Okay, in fact, your rib was harvested for you. Any pain or discomfort with respect to that? Nothing at all? Okay, fine, sounds good. We'll follow it up with him probably a month later or so, and let's see as to how the results are. Thank you.